Hello, and welcome to the Micromolar Podcast Health and Wellness Series.
Today, we're diving into a topic that's generating a lot of buzz in longevity circles: rapamycin.
That's right, listeners might have heard of it as a potential anti-aging drug, but its history is much more complex. So, what exactly is rapamycin?
Clinically, rapamycin, also known as sirolimus, is what's called an mTOR inhibitor. For decades, it's been used primarily as an immunosuppressant.
Right? So, it dials down the immune system.
Exactly. In the US, it's FDA approved to prevent kidney transplant rejection and to treat a rare lung disease called LAM. But because it's a powerful drug, it comes with some meaningful risks, like a higher chance of infection, impaired wound healing, and even increased malignancy risk.
That's a crucial point. It's not a supplement, it's a serious medication. So, where has it shown the clearest benefits?
The strongest evidence is in that rare disease, LAM. The MILES trial showed it could stabilize lung function, which is a huge deal for those patients. It also works well in certain rare mTOR-driven tumors. For example, a trial for a rare cancer called malignant PEComa showed a nearly 40% response rate.
Okay, so it's a validated, effective therapy in these very specific clinical cases. But let's get to the reason it's become so famous: aging. Where does that idea come from?
That excitement stems almost entirely from preclinical data. There was a landmark study published in the journal Nature that showed rapamycin extended the lifespan of mice, even when they started taking it later in life.
And that's the headline everyone remembers: mice living longer. But what about us? What does the human data say?
That's where we need to pump the brakes. To date, no human study has ever shown that rapamycin extends lifespan.
A critical distinction.
A very critical one. Some early studies on older adults suggest that low-dose mTOR inhibition might improve immune function, like how well they respond to a vaccine, for instance. But these are what we call surrogate endpoints. They aren't definitive measures of a longer, healthier life.
So it shows a biological effect, but not necessarily the outcome we're all hoping for. And I read there can be some undesirable metabolic effects too.
That's right. Some studies show increases in cholesterol and other mixed metabolic effects, so the long-term picture in humans is still very incomplete. And in other areas, like neurodegeneration, the data is even more preliminary, with no clear cognitive benefits shown so far.
So, to sum it all up, rapamycin is a well-validated, powerful therapy for a few specific conditions. But its role as a general anti-aging intervention in humans remains totally unproven.
Exactly. The science supports the biological plausibility, but we just don't have the evidence for the hard outcomes, like a longer lifespan or a broadly improved health span. The jury is very much still out.
A fascinating topic, and a great example of where the hype can sometimes get ahead of the data. That's all the time we have for today. A big thank you to the Marigin Health Foundation for their support. Join us next time on the Micromolar Podcast.